Hello and welcome back. In this video, I'm going to be looking into this overlap between the perimenopausal period and fibromyalgia with regards to women, of course. As many of you know, fibromyalgia is one of my interests and I've been looking after patients clinically both within the NHS and privately for a long time. I've helped set up the local community pain service where there is a dedicated program for supporting patients with the diagnosis of fibromyalgia. And again, as we are all aware, fibromyalgia is incredibly more common in women. Now, the reasons for that are quite a number, and I've talked about that in other videos. But there is something that is never been really taught about, and it's something that even I have only come to understand in the last few years about this potential overlap and the confusion that can sometimes happen when we are trying to treat fibromyalgia in somebody who is within the perimenopausal period. Now again, as far as I was taught, menopause was something that happened in women when periods were completely stopped for more than 12 months. And this was something that in my head I always assumed happened in the late 50s or maybe in the early 50s. But this is now a big change in information. We are now aware that the perimenopausal period is actually a much longer time than any of us had thought possible. It can start in patients as early as late 30s. So by the end of 34, 35, 36 years of age, and it can go on right up till the 55 to 60 years of age. That's a really long period of perimenopause, meaning that it can all be around the time where there can be hormonal changes. And if you look at the symptoms of this perimenopausal period, apart from changes that might happen around the period's time, patients can often have a change in mood. They can often have fatigue. They can have change in aches and pains. Indeed, studies have shown that there are 2 times more incidents of chronic pain in someone in the perimenopausal period as opposed to any other time of a woman's life. Apart from that, there are other symptoms that are like chronic aches and pains. There will be, as I said already, fatigue. There can be sleep disturbances. There can be concentration and memory issues. And if you realize, those 4 things that I mentioned now, concentration problems, sleep issues, pain, fatigue, and memory issues, they are all also seen in fibromyalgia. In fact, they are the cardinal symptoms in fibromyalgia as well. But somehow guidelines for fibromyalgia have never really talked about the role of this perimenopausal period and what that means. And often this has been something that I've had conversations with, and I've also learned a lot while helping patients with long COVID, that we could potentially be sometimes conflating and confusing. And is it possible that we may be making the diagnosis of fibromyalgia in someone in their late 30s or early 40s, when actually it might be a perimenopausal change that's happening? And that's quite relevant because right now the treatment paradigms for fibromyalgia is to move more, is to actually think about medications like tricyclic antidepressants or sometimes stronger drugs like gabapentin or pregabalin. And we know that those drugs have problems, those drugs have issues, and they do not have a clean profile. They have side effects that patients are often worried. Gabapentin and pregabalin is now a controlled drug in the United Kingdom. So all of this means that we have to be really sure that when we give the diagnosis of fibromyalgia, we have ruled out everything else. And increasingly, when I now see women in the late 30s to almost the mid 50s, it's probably useful to inquire about perimenopausal changes. And the reason I think this is relevant is it's possible to actually test and treat for that very differently to how we manage fibromyalgia. Primarily, I think we need to be looking at examining for hormone levels. Specifically, we know that in menopause and perimenopausal period there can be changes and fluctuations in the levels of the female sex hormones and sometimes the male sex hormone testosterone. Now, females also have some testosterone, but it's very low amounts. So actually testing for these hormones should be a part of our standardized management and criteria for diagnosis of fibromyalgia. And before we make the diagnosis of fibromyalgia, it may very well be a good manner, a good sort of clinical practice to test for hormone levels in women and to actually consider the role of hormone replacement therapy in some women where that is appropriate, where there are no contraindications. Certainly the availability of nowadays HRT in biosimilar form means that you do not have the side effects that we read about HRT 10 years ago. It's a lot more safer. There are in fact some protective reasons as well, and I'll be exploring this in future videos, and I'm going to be doing some work with other experts in the field in the next few months, so watch out for that and videos from there. But for now, probably the take-home message from this video is that if you are a woman in the perimenopausal period, and that could very well be the late 30s to the mid 50s, it's probably useful to speak to your general practitioners, to speak to your pain specialist or your rheumatologist, that before the diagnosis of fibromyalgia is made based on the 4 symptoms or the 2016 criteria, we specifically look at blood tests to rule out any potential contribution of perimenopausal changes, optimize for that, treat for that as well before offering a diagnosis of fibromyalgia. Thank you for listening to this video. Hope this provided value. Please don't forget to share this video if you find it useful, and also please subscribe to my YouTube channel. Thank you. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.